All right, Andy. Welcome to the show
Thanks for having me. Good to be out here.
in California.
Yeah. Early flight this morning.
Mhm.
Up and back in a day. Great thing about Austin is you can get to the West Coast and back in one day. So that's the plan today.
I know that it's like not even 2 hours, no?
No, it's about 2 hours. Yeah,
Yeah.
right on.
Awesome. So for everybody that doesn't know you, how would you tell people who you are and what you do?
Yeah, just a normal guy from Austin, but in essence, what we're trying to do is destroy health insurance.
Love it.
Everybody hates health insurance, and so we are trying to burn the healthcare system down and start it back up again. Starting with health insurance, trying to get doctors to start accepting cash instead of health insurance. And we really believe that the best doctors in the world are going to be cash pay doctors as opposed to taking health insurance because it's such a pain in the ass to do that. So, yeah, we're trying to replace health insurance with something bigger, better, and way easier to use.
Is it that how it used to be, where only on like big emergencies insurance would come into place and like a normal doctor visit used to be all cash?
Yeah, exactly. And then they've added a bunch of things over the years where, the health insurance has to pay for colonoscopies and going to your primary care doctor and all of these things. And what, in essence, that has done is it has raised the price of healthcare because you and I are no longer paying for it. The health insurance plan is paying for it. So we don't have any incentive to shop for prices or anything like that. And so the prices have gone up. And even worse probably is the doctor no longer works for me. Since I'm not paying the doctor, the health insurance pays the doctor. They're not working for me. I always say you work for whoever pays you. And so if I'm going into the doctor and the health insurance plan is paying for my visit, guess what? The doctor's going to take care of the health insurance company as opposed to me. When I go and I pay with my credit card, he's now my doctor. He works for me. And that changes the whole dynamic. So, one of the things we allow people to do with CrowdHealth is, hey, you go in and pay in cash and you're going to get a way better rates as a result of that. And it reestablishes that doctor-patient direct relationship without health insurance plans and government and all that getting in the middle.
Maybe explain to people how CrowdHealth works.
Yeah, we kind of say it's back to the future a little bit, right? Because back in the future, or in the past, you had this community of people who, in the agrarian communities of the United States, if somebody got hurt, a bunch of group people would rally around them and help them, just like good neighbors do. And over a period of time, especially over the last 50 years, the health insurance plans have gotten in between us and our neighbor. The government has gotten in between us and our neighbor. And so you just don't have that anymore. So, if you were to get hurt and break your arm, what CrowdHealth would do, since you are a member, we would go out to, let's say it's $5,000. We would go out to 50 people and say, hey, would you help Ken with, $100 each? And they could say yes or no. And if they say yes, then $100 goes directly from my account to Ken's account. And then at the end of that 50, you'll have $5,000 in your account where you can go and pay your doctor directly for your broken arm. That doesn't take too long. It takes 3 or 4 days to get that crowdfunded. And so you have that money, pretty quickly so you can go and pay for your broken arm. And so then the question is like, okay, why would I, help you if I've never even met you? I have today, but I don't know Ken from anybody else. And so when you submit your bills for that broken arm, I know two things actually about you. One is when you've been asked, have you said yes to others in the community, or have you said no, 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 no? Right. So have you been a good member of the community or not? And so 100% of the bills that have been submitted by people who have been good members of the community have gotten paid, have gotten fully funded. About 5% from members who are not good members of the community. So I know that about you. And then I also know is, did you go to, the most expensive place in town? Did you shop at all for this? Or is it egregious? Is that broken arm going to cost $20,000 to fix when it should be $5,000? That's the other thing that we know. So you now as a member, or I guess you were the one asking for the money. I as a member know a lot about you and your bill, and so I can decide what bills get funded and what don't. So, and ultimately at the end of the day, what that does is it massively reduces costs. So a family of 4 is about $600. If you go anywhere else, a family of 4 is $1,200, $1,400, $1,600 a month. So it's significantly less. And there's no big deductibles. So you don't have to pay the first $10,000 or $15,000 out of pocket before the health insurance plan pays something. So it is significantly less expensive than health insurance.
Yeah, I used to pay, I think, $2,000 every month.
Jeez.
Yeah, Blue Shield.
Yeah. And now you're paying $605 max.
Yeah.
Yeah. So you're saying $1,400 a month. That's $20,000 a year almost.
And the incredible thing is not only that, but also that like when you do a home birth, as an example, no insurance will ever cover that. It's like because you're not part of the hospital and you don't go into the whole system, they don't want that. And no matter if you have platinum, silver, gold, they don't care.
Yeah.
And I think you guys you don't like, it doesn't matter to you if it's home birth or hospital birth.
We love home births.
Yeah.
Yeah. And crazy enough.
And no insurance does.
The crazy stat is that 1.6% of babies throughout the United States are born at home. With CrowdHealth, the last time I checked, it was about 40%. So almost half of the babies with CrowdHealth are doing at-home births.
Wow.
Which is significantly less expensive than heading into the hospital. And the outcomes are just as good. So, yeah, we're all supportive. You can have your doula, you can have your midwife, you can, do all the things that you need to do to make sure that your home birth is a pleasant one. So we're all for home births.
Amazing. And then can anybody join CrowdHealth?
Yeah, there are only two things that we don't accept. One is if you're over 260 pounds, if you're a male, or over 220 pounds, if you're a female, then we do not allow those folks in. We do make exceptions for folks with, significant muscle mass. So if you're 6'5" and you're 260, but you're stacked, that's fine. In essence, what we're trying to do is get rid of the people who aren't really taking care of themselves. So if you're taking care of yourself, we'd love you to be a part of the community. And the other thing is smokers. It's terrible for you. If you've smoked every day for a year, then smokers are not tobacco smokers are not allowed in the community. So, it's just we just want a group of people who take care of themselves. And in essence, what that has done is we now have a bunch of 25 to 35-year-olds who are a part of our community. They're healthy. You're not subsidizing people who aren't taking care of themselves. You clearly take care of yourself, and you should reap the rewards for that financially. And through your healthcare, and so you're paying, you're saving $1,400 because you take care of yourself and a member of CrowdHealth, and that's really what we want to do. I think the only way we change healthcare in the United States is people have to get healthy. I wouldn't have to be around if people were healthy, but we're 50% more obese than any other country, in essence, throughout the world, first world country, and so that's the big problem. So we're trying to create incentives for people to get healthy. We had a guy who, I think he was 280 or 290, and he really wanted to join CrowdHealth, but he got rejected. And so he went and he started training, he started eating better, and I think he's down to 230 now, 220. Member of CrowdHealth sent me a picture on Twitter of him and his wife, who also lost a bunch of weight, doing triathlons. All because he wanted to join CrowdHealth. And I was like, man, that's what we should be doing, is we should be incentivizing people financially to get healthy and to start eating better and working out and doing the things they need to do on the lifestyle side. So that's our goal.
Yeah, and I've always been baffled why should I, if everybody's obese, why do I have to pay for their lifestyle? Like if most people live very unhealthy, and I try so hard to be healthy, but then the $2,000 I pay every month, I don't use that up. Nobody uses that up, my family, right? But
for sure,
I know who does, and you can see it every day. People living really unhealthy, and then all that money goes to them, and you support somebody in their unhealthy choices.
Absolutely. And I don't think you should have to. And a lot of people will probably disagree with that, but you should not have to subsidize other people who don't want to do the hard work to take care of themselves.
Absolutely.
It takes work to get up in the morning and work out. It takes work not to eat the sugar-laden foods. It takes work, and you should financially benefit from that. So we at CrowdHealth allow you to do that. And we're trying to get more people incentivized to do that and inspired to really start taking care of themselves. Again, that's the only way we're going to change anything, or else this country is screwed, and we're going to go under bankrupt due to healthcare costs. Healthcare is $4.6 trillion in the United States, which is, if it were a country, the fourth largest GDP in the world after the United States, China, and Japan. I think it's about to exceed Japan in the next 2 or 3 years. So that's how much we spend on healthcare in this country. It's twice per capita as any other country on the planet. That's how bad this is. But you know what? If you have somebody who's 300 pounds and you give them a knee replacement, guess what? That's going to be way more expensive than somebody who's 180 pounds and gets a knee replacement, because that knee replacement is going to have complications. You probably will have to redo it. Everything becomes way more expensive when you're obese. And so that's the problem that we have to solve. And, we're also seeing it in life expectancy. We're the lowest life expectancy of the first world countries too, primarily because of the chronic conditions that results from being obese. That's the problem.
And I think the most unhealthy children too, ever.
It's a tragedy.
Yeah. I heard that. Robert Kennedy always says that's the most, what makes the most money is a sick child.
The most profitable patient in the United States is a sick child. And so you wonder, the incentive systems, I think it's all about incentives.
Mm-hmm.
The incentive then is to keep that child on drugs and, all kinds of crap for the entire life, because that's a really profitable person. There was an analyst report from Goldman Sachs. Goldman Sachs, one of the leading investment banks in the United States, they said, is curing patients profitable? That's the question they asked. And this was on like a pharmaceutical analyst report. So it was like, hey, pharmaceutical companies, if you actually cure somebody, they are no longer making money for you. Is that a profitable business model? Like, that's how screwed up our system is.
Man, and then, if you screw somebody up from birth, they will be patient forever.
Forever.
Yeah. If you weaken their immune system enough, and the rates have been skyrocketing. If it's allergies, autism, you name it, and it's crazy when you look at the children. Yeah.
Well, and how much money has gone into getting all these vaccines on the vaccine list for newborns. I don't know what it's up to now, but it's above 20 vaccines that these kids take, like right after they're born. Their immune system hasn't even gotten used to like the outside world.
Yeah, it's 100 for age 10.
100 before age 10, which is crazy. And some of these, I think it's hepatitis B, where you can only get hepatitis B through sexual contact or blood. And so what are these kids doing that they would be at risk for hepatitis B when they are, a few hours old or a few days old? It's ridiculous to me, but it is a recurring revenue stream for these pharmaceutical companies to keep these on that vaccine list, and they make a ton of money doing that. And in fact, insurance companies actually pay pediatricians extra if a certain percentage of their patients are fully vaccinated. So, it's big money. Some of these docs were getting paid $40,000, $50,000, $60,000 a year extra during COVID to get their patients, vaccinated. So there's a whole system here, a whole game. I call it the medical industrial complex that is continuing to reap profits from patients being sick. So health insurance companies want patients to be sick. We can talk about that if you want to. Hospitals clearly want patients to be sick, more business for them. Pharmaceutical companies want patients to be sick because they want them to keep taking those drugs. So you've got the three pillars of the medical industrial complex all wanting you to stay sick. And so where do the incentives lie? To keep you sick. And so that's the challenge that we're up against. For us, we actually make more money if you're healthy. We want you to stay with us longer. Our incentives are totally aligned. If you stay healthy, you're going to stay with CrowdHealth. I'm going to make more money over the long term. That's the way it should be. Not so for the rest of the big players in the medical industrial complex.
Do you ever get that you're too discriminating for your company?
Yeah. People are really pissed off that they can't join because, they're 300 pounds or, they smoked like a chimney for 25 years. It's like, look, I don't think that others should have to pay for your bad lifestyle choices. That's in essence what it is. And in essence, when you talk to a libertarian who moans and groans that they can't join because they've made bad choices, I'm like, look, you have personal sovereignty over yourself, and so you live with the choices that you've made in the past. That's just a part of it. And so, even they have trouble with it. So yeah, all the time we're discriminate against people. And I was like, we just discriminate against people who don't take, good care of themselves. I don't care if you're a Democrat, a Republican, gay, straight, Catholic, Muslim, Jewish. I don't care about any of that stuff. I just want you to take care of yourself. So, I think we discriminate a lot less than others for sure.
And you can just do that, or is there because I heard you even have to hire a certain amount of genders or people from somewhere else in companies, and can you just set a weight limit?
Yeah, we can, because we operate so differently than health insurance. Mm-hmm. So since we are a voluntary crowdfunding platform, then we can do basically whatever we want. And which is great. So there's no, regulatory boundaries there. And now, look, some regulatory agencies have come after us, and we spend hundreds of thousands of dollars a year on attorneys, fighting those regulatory agencies. Mm-hmm. But in the end of the day, 99.8% of the bills that get submitted to the community get funded. For health insurance plans, it's around 83%. So we're significantly better than health insurance plans in terms of getting these bills paid. And so when they see this data, they're kind of like, you're actually doing better for our constituents than health insurance companies. Maybe we should let you continue on for a while here. So we had multiple states, basically take us to court. And we have won those showdowns. We're in a third showdown now. So, we'll see how these go.
And you don't care?
No, I mean, look, if you're doing something big mm-hmm. and revolutionary, especially when it's against massive players like United Healthcare and CVS, Aetna, and these huge companies that are in the top 10 largest companies on the planet by revenue, we know that it was going to be a war. I mean, that's what we're in. We're in a war to change the way that healthcare is paid for in our country, and so I think it's worth those battles. This is my second company. I sold my first one for a lot. And so this is, for me, more of a missional thing than it is to make a lot of money. This one is we need to change healthcare. So my kids, I just met your kids, have something that is not, garbage government-run healthcare where the government tells you what you can and cannot do. I mean, I don't want that. I want a viable alternative to that. But we're going down the path of the government owning our health. And I want to provide an alternative. So, if there's anybody out there that doesn't want that either, join us in this kind of revolution to change the way that we do this, because I think we need it.
What do you think about, born in Austria, I used to think free healthcare is the way to go. Mm. But if you look into the reality, you realize that it doesn't work. So on paper it works very well, but then when you look, the places are overrun, the quality lacks, and it seems that there's a lot of people that make poor choices and don't care about their body and themselves, and I don't know. What do you think about free healthcare?
Yeah, I mean, look, it's not free. I mean, they have to pay it in taxes, yeah. So their taxes are significantly higher than ours, and so they're paying for significantly higher. So you're paying for it. It's just you're paying for it in a different way, and you're paying for it through the government, which is, from my perspective, an inefficient way of paying for your health care. I think we were seeing, especially during COVID, Canada, which is our neighbors to the north. It was a tragedy during COVID. If you needed a knee replacement, I think the wait time was something like 9 months or 12 months. And at that point, you almost need to redo it, right? I mean, can you imagine having a torn ACL and that you couldn't get fixed for 6 or 9 months? It's terrible. I was on a podcast last week with a guy who's from Canada, mm-hmm. and his wife had COVID, and she went to the hospital. And they actually stuck her in a janitor's closet because they didn't want her, with COVID. They basically said, "What are you doing here? You need to go home and just drink water." They wouldn't give her any drugs. They wouldn't do anything for her. And in Canada, you can't pay doctors directly. And so he had to find an underground pharmacy to buy all the drugs that he needed to buy. And he's like, within 24 hours of taking those drugs, my wife felt better. Her oxygen levels and her blood got better. And the hospital would do nothing for us. I was like, well, that's government-run healthcare for you. We see it in the United States. The veterans, the VA, the Veterans Administration hospitals are awful in the United States. And that's the government-run healthcare system. It's god-awful. And so it's just, man, we can't have that. We saw what happened with COVID, where people, you were getting arrested for going outside their homes, all this kind of crazy stuff. We can't have that with kind of an expansion of government intervention in our lives. That's a hill I will die on.
And yeah, in Austria, you have free healthcare and free education, but then you pay 50% taxes. So you work half a year and you give that all to the government, and then that all doesn't end up in your education and in your healthcare.
Right.
That's just a very small part that ends up there. So, and also as a you want to start a company, or everybody that is some sort of like intelligent leaves, because you don't want to make big business and then give half of that business away.
Right, exactly. And a lot of people say, "Oh, well, look at Singapore, or look at Switzerland, or look at some of these other countries, or even the UK. They do great with their national health service." And I'm like, well, look, the United States, one, is much larger geographically, so we are less dense than they are. Two, we are way more diverse than those countries in terms of just the population diversity. And then, three is we have horrific eating habits. And so those three things make us very, very different than some of these others. I mean, you can't take a look at a country that has 15 or 20 million people and say, look, it worked there. Why can't it work in the United States that has 350 million people? Well, it's just not, you can't use that analogy. It just doesn't work. That's basically saying like, oh, it worked for Texas. Or California, it's similar in size. Why doesn't it work everybody, in the entire country? Well, because we have Alabama, Mississippi, and North Dakota, and Montana. Like, these are very different places that have very different geographies, that, types of people. It just doesn't work the way that people think it should. It's a very, sophomoric way of looking at our healthcare system.
How many people do you have in CrowdHealth?
Yeah, we're almost to 10,000 people signed up. And so we should probably hit that number in the next 30 to 60 days. So that'll be exciting. We're going to try to do something fun around the 10,000 member mark. Yeah. And I feel really good about that. As you can probably imagine, when I started the company 3 years ago, when we had the first guy who signed up was in Houston. He was a crowd of one. Hard to get a cancer patient, with a crowd of one paid for. But now that we have 10,000, I don't stay up at night worrying about, bills coming in, because we've had major motorcycle accidents. We've had, 15 or 20 different types of cancer. A guy just a couple weeks ago, accidentally shot himself on a hunting trip. Went into his calf, into his thigh, into his stomach, and out the back. And that's going to be $1 million bill probably. And so, finally I'm not in a place where I'm worrying about that, because the community has shown that they're willing to step up and pay for these things. And so we feel really good about where we're at.
And I just got an MRI on my knee, and I paid like $300.
Oh, yeah.
And my wife got an MRI at the hospital, and it was like, I don't know, like
6,000 probably.
Yeah, it was like almost like $10,000.
Yeah.
A $10,000 MRI, and I was like, it's like 9,000 something.
Yeah.
And I looked into the breakdown, and I got that for $300. It seems like they just make these numbers up.
They do. I mean, that's a perfect example. I'm glad you brought it up.
Yeah. I literally saw that on paper.
Yeah.
Yeah.
And you can go and pay cash at the local place and get your knee MRI'd for $300, $400, $500, depending upon where you are. If you step into a hospital, it's 10x that. And so that's what we tell our people. Like, whether or not you're a CrowdHealth member, if you can stay out of the hospital from getting services at the hospital, you're going to save a ton of money. So if you have to get imaging, if you have to get labs, if you have to, even oftentimes outpatient surgeries, outpatient meaning you go in, you get the surgery, and you leave the same day. All of those can be done outside of hospitals, and they're significantly less expensive. And most of the time, they're actually higher quality. And so stay out of those hospitals if you can. The only reason I would go to the hospital is an emergency. If it's an emergency or an inpatient, complex surgery, like a heart surgery or brain surgery or something like that. Otherwise, there's other places that you can get these for way, way less expensive, as you just showed in your example.
Yeah. Another great example is she had a gallstone, and they took it out, and then they wanted to take her whole gallbladder out because they said, might as well.
We're in there.
They're
Let's
like,
take it out.
I don't have a gallbladder. We should take yours. And then they wanted her insurance, but it's not regular insurance. So because she didn't have regular insurance, they were like, nah, we're not going to do it.
We're not going to take it out.
Yeah. And so she was able to keep her organ because of CrowdHealth, because they were not as motivated to take her organ out because of it. Like you said, the incentive of the insurance. If they want to get the money through the insurance, you need that insurance, and if you don't have the insurance, they're like, okay, whatever.
Yeah.
So it wasn't even needed to take the organ out.
I truly believe you get better care
Yes.
when you pay in cash.
Yeah.
They
treat you different.
They treat you different, and they treat you better. I had a heart palpitation like a year ago, and I didn't know what was going on. So I went to the cardiologist. The cardiologist was like, hey, since you're a cash pay patient and I'll have to bill insurance, I'm just going to send you to this imaging center. And I got something for $300 that I think it was $250 that a guy on Twitter told me he got for $6,000. So I'm going to send you there instead of this other place, which is much more expensive. I was like, great. And he's like, and typically I will call people back into the office to do another visit. But since you're cash pay, can I just call you and give you the results? And I'm like, hell yeah, you can do that. Like, why would I want to come into a doctor's office in the middle of the day and spend, an hour sitting in doctor's office with a bunch of sick people when you can just call me on the telephone? But with insurance, he gets paid for that second visit. For me, he just like, don't worry about it. I'll call you. I mean, I think you get treated way better if you're a cash pay patient. And people are afraid of that. Like, oh, well, if I go to the ER, do I get treated differently if I'm a cash pay patient? And I'm like, no, it's actually illegal for people to treat you differently if you're a cash pay patient when you have an emergency. They have to stabilize you. And so there's no difference between cash pay and other. So it's just a way better experience from my perspective.
Man, and I mean, who wouldn't want to join, right? It makes much more sense. It's much cheaper, and you don't pay for somebody making really unhealthy life decisions.
Yeah, I mean, I don't know, man.
Just honestly, somebody overweight, I guess.
Overweight,
But even then, it can motivate
you. People who live by fear. Yeah. People who live by fear, and our number one issue is people being like, "What if I get cancer? What if I get hit by a truck? What if all these things?" And I was like, look, we've done this over and over and over again on the cancer side. Breast cancer, colon cancer, cervical cancer, thyroid, all kinds of different cancers. We've done it on the motorcycle side. We had a woman who had a brain hemorrhage, and we've had a NICU baby, neonatal intensive care unit baby, who was in the NICU for, I think, months. And so we've done all of these things. And so I feel really good about having my family because I've seen CrowdHealth firsthand do these things, like get these bills paid. And two, it's way cheaper. My family saved $20,000 last year, similar to yours. And so I was like, why would you not do that? Like, is it really worth it for the 0.25% chance that something really big happens? You don't want to save $20,000 for that? It doesn't make any sense to me. But I see it firsthand. I see all the bills coming through. I see them getting paid. So it's much easier for me to say it because I see it, firsthand. So, I don't know why people wouldn't join other than just fear.
What made you start the company?
Yeah, I thought that I could go on healthcare.gov and get a health plan. So healthcare.gov, for those of you who don't know, it's where you go and buy healthcare if you don't get it from your job. Mm-hmm. And so I got that, and it was $1,200 a month, I think, or like that for my family. And this was 5 years ago. And so I joke it worked until I had to use it. My little one, who was having recurring ear infections, we went to the ear, nose, and throat doc, and he said, "Oh, well, she's got a hole in her ear." And so you need to get tubes in her ears to let that drain, all the liquid in her ears drain. Because in essence, what happened is the liquid built up and popped her eardrum, and so she needs to get a tubes in her ears. Okay, great. So he pre-authorized it with the health plan. We went and got it. It was a 15-minute procedure. We were in the hospital for less than an hour, and he got the bill as $8,000. I'm just like, holy crap, $8,000. I was like, all right, well, this is what health insurance is for. Like, this is the point, right? A few weeks later, we got a note in the mail from our health insurance provider, and it said, hey, it's medically unnecessary, so we're not paying for it. I'm like, what? My daughter has a hole in her eardrum. Like, what are you talking about? So we went through 3 rounds of my doctor fighting with their doctor. They even pre-authorized it. And they still, at the end of the day, said, no, we're not paying for it. And so I had to stroke an $8,000 check to the local hospital, and I was pissed. It was at that point where I was like, man, like, I thought that if I had a healthcare event that the insurance plan had to pay for it. But come to find out, 40 million claims last year from the healthcare.gov plans were denied. That was almost 20%. So you have a 1 in 5, 1 in 6 chance of your claim getting denied. I was the 1 in 5 or 1 in 6, and it cost me $8,000. I was like, this is BS. And it's like, man, I've been super fortunate. I can pay the $8,000, but we have something like 75% of the people in this country don't have $5,000 in their bank account. So they couldn't pay the $8,000. It was putting them into bankruptcy. And so we have to do something. And so that's when I was like, man, screw this. I'm going uninsured. And so I have been uninsured now for over 4 years. And I've been with CrowdHealth, which is not insurance. So I'm technically uninsured. And I like the fact that I'm uninsured. It gives me way more freedom, way more control over my own healthcare. I actually have a T-shirt. I'll send you one that says uninsured on the front. And it's like, hey, we own it, because now we're in control of our healthcare and not an insurance company. So we started it back in 21. So we're, over 3 years in. So it's been a fun ride.
So what is it technically?
We call it healthcare crowdfunding.
Okay.
So you have a crowd of people. We call them the crowd. If you're a member of CrowdHealth, you're a crowdy. We call you a crowdy. And we have a group of people who are willing to help each other out when, in the case of a big healthcare expense. And so that's what we call it. And it's, like I said, it worked great.
And that's how you get away with the discrimination?
That's how we are able to not have the regulatory intervention that health insurance plans have. So, and all the states that have come after us is saying, you are health insurance. We said, no, we're not health insurance. And here's the reason why, X, Y, and Z. And they look at that and they're like, yep, that's right. You aren't health insurance. And so we're not health insurance. So we don't have to follow any of the health insurance regulations.
Okay. That makes sense.
Yeah.
What do you think about airlines doing the same? Starting discriminating about fat people. There's this meme. Have you seen this meme where you you just paid, I don't know, $100 for a 5-pound overweight bag, but then you see somebody check in that is like rarely overweight,
and they get on, and sometimes they get 2 seats, right? Like, I think
they should,
right?
Because they need 2 seats.
That's egregious. I think it'd be great, actually. I might get blowback on this.
It is about the weight and everything you pay for the weight when you send something per mail or ship something, right?
So why not pay by weight?
Yeah.
And my two little kids, who are 40 or 50 pounds, maybe they should pay a little less because they're consuming less fuel because the airplane is lighter versus the guy who's 300 or 350 and has to take up 2 seats. It makes sense that they pay more. Yeah. There's something in our culture, and I'm not sure exactly what it is. You come into our culture, so maybe you have a different viewpoint of this, but it's like people feel like we're shaming others because of their weight. And I don't think it's shaming. I think it's actually loving them and saying, hey, this isn't healthy. This isn't good for you. Your life expectancy is going to be 10 years less than someone who's not obese. Like, please, take care of yourself. And let's give you incentives to take care of yourself. I think that's a great posture to take. It's not that we're trying to be unloving towards other people. It's being like, no, you've got to change your lifestyle so that you can take better care of yourselves. And I don't want to pay for that. You have to pay for that. I don't think there's anything wrong with that. So, but I think there are certain folks in our country who think that's discriminatory and hateful and things like that. I think it's actually loving.
No, and under underman when somebody is weak and you like pick on them. It's always out of a loving kind of like keep up, or in a sports team when you like pick on people, it's not because like, or I remember that when I played football in America, that it was never about putting somebody down. It was more about like, we're gonna raise you to this level or to this standard where everybody else is, kind of, and you like lovingly make fun of each other and like shame each other as men to make each other better at the end of the day, and not be acceptance of somebody being lazy or weak. You would always be like, yo, like, like.
I mean, I think you saw it with what was the Netflix special with Michael Jordan, The Last Dance, I think it was, where Michael Jordan would like pick on his other teammates to make them better.
Yeah.
Like, I'm doing this because I love you. I want to win. Let's go. Let's do this. We're a team. I think Tom Brady just came out with, I forget what the QB of the Buccaneers is now, and he basically said that all of his teammates told him that it wasn't any fun playing for Tom Brady, and Tom Brady responded and was like, "But you know what? We got a Super Bowl ring, and that was a hell of a lot of fun." It's like, you can have fun, but you're not going to win the Super Bowl. You're going to go work. You're going to go win the Super Bowl. It's like, look, it's not fun not having the birthday cake or the brownie, because I mean, there's something that's really good about that, at least from my perspective. It's not that fun when you're in the gym at 4:45 in the morning, like hurting. But at the end of the day, you're taking care of yourself, and you got to have pain to build and to grow in almost any facet of life. And so I think the problem with our society partially is because we have rebelled against anything painful. We wanted to eliminate pain, and I think we have become soft as a result of that. So I think that the people who are willing to take on that pain should be compensated for that in some way. So, it's just a softening of our society, I think.
Absolutely. Man, and kind of you need to discriminate too, because you need to discriminate up against people that are like violent, people that are treat people bad, and I felt like sometimes, or with liberals, the tolerance just becomes like next level, where you need to be tolerant amongst anything, even against lazy behavior and hurtful behavior towards yourself and towards other people.
Yeah, and at some point there's no laws. There's just like, you got to be tolerant of everything.
Yeah.
Like these people who are, having like breaking the law in significant ways, like hurting other people, getting out on bail, and you're like, wait, what? Like, how does this work? So yeah, there's just a softening of our society that it's leading to all kinds of issues.
What was your first company?
We did. Funny enough, I was selling into health insurance plans, remote patient monitoring. So I would monitor folks with chronic conditions. We would monitor their blood pressure and their blood sugars and their weight and things like that. So, if you're diabetic and your blood sugar spiked, we could get involved, or went low, we could get involved and say, hey, what's going on? Like, what did you eat? What did you take your meds? Did you do what you needed to do? And we were actually trying to help these folks with, especially type 2 diabetes, reduce the amount of carbohydrate intake that they had, and do things like that to have their diabetes be better. And so that went really, really well. I ran that for full-time about 7 years, and then part-time another 3 years. And so about a decade of doing that. So sold that back in the mid-teens.
And are there other companies that you're thinking of?
Man, I'm all in on this one. This one is a full-time job. When you're trying to, blow up health insurance, it's a full-time gig. I'm in on this one for a while. And people ask me like, when are you going to get tired of this? And I was like, I'm 3.5 years in, and I'm still having a great time, and I love the company more today than I did, 3 years ago. We've got a team of about 25 people, at CrowdHealth now. Love them. They're awesome. And, I can come out into LA and do things like this with you because I have really awesome people that are helping me, at home. And so it's just a lot of fun right now. So I'm focused on making this great.
And what states are pushing back?
I can't say.
Can't say. Well, it's kind of obvious.
It's interestingly enough, it's red and blue states.
Okay.
So we've had some blue states and we've had some red states, big states who have pushed back. So it's mostly the big states. They've got these huge departments of insurance, and so they have the capacity to do this, and so those are the ones that are pushing back. So, if I gave you a few choices, you'd probably nail them.
And then you said like the biggest reason why people are not joining would be like big catastrophic
Fear, FUD,
yeah,
fear, uncertainty, and doubt.
Yeah,
which look, this is pretty foundational in terms of Maslow's hierarchy of needs. Like it's you need to take care of yourself, and if you don't take care of yourself, all kinds of hell breaks loose. So it's pretty foundational in that, and people are just fearful of trying something different. I think we've been psyoped into thinking that insurance is the only way. From at least in the United States, from when we were kids, it's like you have to protect yourself. You have to protect yourself. You have to have health insurance. And so anything different than that, people are like, oh, wait, this is weird. Even if I can save $20,000 a year, this is weird. So, fear overcomes the kind of financial benefits. And that's the number one reason why, people aren't joining. Or if they don't join, that's the number one reason why. And so we've done a lot of things to make it more transparent. So all the bills that are submitted to the community are online, so you can go and see them. You can see what happened with them. We're making that super transparent. We tell people how many members that we have. We tell them what percentage of funds get billed. We tell them how many bills we have crowdfunded in terms of dollar amounts. And so we're being very transparent with people around like all of the bills, so they can see it. They're like, hey, we have nothing to hide here. And so we're trying to build some trust up with people. The other thing, too, it's been great for our business is at the beginning of the year, about 15% of our customers came from existing customers. And last month, it was about 47%. And so, if you have a friend who knows CrowdHealth and has had a great experience, that's way easier of a sell than somebody who just comes out of the blue. And so our members are our number one driver of new business now, which is great because we don't have to, pay for really expensive advertising. And the last thing I want to do is give my money to, big tech companies out here in California. I'd prefer to give it to our members. So if you're a member of CrowdHealth and you refer somebody, you get $250. So if they're with us for 3 months, we'll hand you a check for $250. So a family of four is $1,000. So I think we gave $20,000 last month, maybe more than that, to our members. So it was awesome.
Yeah, I think for me it was that I didn't know about it until I had Sean Baker on.
Oh yeah,
yeah, and he was great, and he told me because I'm always interested like what insurance he has and how he does it. And he told me about you guys.
Yeah. We love Dr. Baker. Yeah. I mean, we have a whole community of just carnivores. So people do just eat meat.
Yeah.
And you actually have to, there's another couple of things that you have to do to get into that community. So we have a sub-community of carnivores, which pay a little less than the other community. And if you have a visceral fat level that is in the bottom 25%, or if you have a fasting insulin I think it's under 6, maybe 5.5. But those are, to us, the closest proxies to having good metabolic health. And so if you have one of those two things, you can be part of our carnivore crowd, which is a little less expensive or even lower price than our other community. And those are all people who just eat primarily meat. They're low-carb people. And you don't have to be fully carnivore. You can be keto, things like that. But that's why we were talking to Dr. Baker, and we got just a ton of business from him, which we really appreciate.
Yeah, I think once more people educate themselves about it, I feel like it will be really beneficial for you guys because it's just like you only know the big companies, how it always used to be, I guess, and you don't really know that you guys exist.
Yeah,
and that's why it's cool when you do podcasts because then people can really like listen in and be like, yo, what is this about?
Yeah, get the full story.
Yeah.
That you're not going to get on like Google AdWords or something like that.
Yeah.
I mean, here you've heard the whole story of why I started the company and how well it's going, and so that's my number one way of getting out there is podcasts. And I'm appreciative of you having me on. You have quite an audience, obviously, but going on Dr. Baker and we have a big libertarian kind of contingent within our group. So Dave Smith and Tom Woods and the Dark Horse podcast and ones like that. So they do amazing for us. We really appreciate them having us on.
Do you ever get like not censored but like suppressed and shadow banned? Or does Google searches, like, do they put you on top, or is it hard to find you guys?
You know what? I haven't really done the research on it because most people are finding us not through Google. They're finding us some other way. Okay. And that's the way I'd prefer it to be. And so, somebody did show me something the other day where when you ask for, like, is CrowdHealth, legitimate, the first thing that comes up is, like, some Reddit post of people saying that we're discriminatory and, we're a scam and all these kinds of things. And so that was on top. The funny thing is the next link down, though, was from a review site that about 300 of our members have submitted reviews to, and it was like 4.8 out of 5.
Yeah.
Right. And so it's like, people just want to call us a scam because they don't understand it, and they are probably beholden to health insurance in some way. So when you try to change a system that people have that make a ton of money, there's a lot of money within healthcare. If you try to change that system, lots of people get pissed.
And especially if Google takes most of their ad revenue from pharmaceuticals, you guys would be like a threat.
For sure.
Right?
Yeah, for sure.
So I would put, like, if you Google, is seed oils bad for you? They're like, no, under the Heart Association, it's actually, there's no research or any proof that it's bad for you. That's what Google tells you, right?
Yeah. I mean, like I said earlier, it's $4.6 trillion. That's a hell of a lot of money to be spread around to a lot of people. It's putting lots of food on the table. It's making profits for these big tech companies. Pharmaceutical, the word now is that Tucker Carlson got booted from Fox because all the pharmaceutical companies, who's so anti-vaccine and anti-pharma, the pharmaceutical companies wouldn't put advertising on his show. And so while he had the number one show in America, nobody would advertise on it because he was saying truth, and so he had to go and now doing his own thing and making a lot more money, I think. And so you then start seeing how all these huge corporations are dictating the policies of our, legislators. We're seeing how ingrained they are in the big tech companies. Elon taking over Twitter. You start seeing the Twitter gate where FBI was involved. All these, federal agencies were involved. I mean, it's incestuous. And so that's why when you take all the pharma, power away from the pharma, power away from the health insurance companies, power away from these big hospitals, all these people feeding, the legislators, people are pissed about that, right? And so, I think there's going to be a continual battle over this healthcare space because of the money. Money is the root of all evil. The love of money is the root of all evil, like that, as the old saying goes, and it's true.
And your company puts like a dent,
a
little bit in that, no?
Yeah, and we're just a gnat on a hippo's ass at this point. But once we get bigger, we're gonna have some legit battles to fight.
And you ready for those battles?
Let's go. Let's do it. Like I said, I sold my last company for a lot of money. I don't need the money, So I kind of have this. I'm in this position like I don't really care. I don't need to work for any of these companies anymore. A lot of people out there won't speak up because they're paid by some of these companies. $4.6 trillion, a lot of people are paid. So they can't come out. But behind closed doors, most of them come to me and say, this insurance thing is screwed up. And they work for insurance companies or they're paid by insurance companies. They won't say that publicly, but they'll say it privately. You talk to anybody who works for an insurance company, they're like, that sucks. It's like, I hate working for an insurance company. I hate telling people that, we're not going to pay their bill. That sucks.
Yeah.
But they won't say that publicly.
So it must feel really good to be making an alternative, no, for people?
It feels great.
Yeah.
I think we've saved our members about $10 million over the last 2 years.
Jesus.
That's a lot of money.
Yeah.
that they can, use to put food on their families' tables. So yeah, it feels great. It feels great. And look, I think, not to get super cheesy here, but one of the things that we allow you to do, and as my example last time, is if you broke your arm, I know my money is going to you. It's not going to some big insurance company. It's not coming to CrowdHealth. It's going to you to help you with your broken arm. We don't touch the money in between. It goes directly to you. And so we reached out last summer. We had a woman who was 19. She got her fingers cut off in a boating accident. So as you can imagine, bills were huge. And we sent this around to our members, and we had members come back and be like, hey, I know.
Per email, or how do you send it?
Per email.
Yeah.
And we just ask you once a month to help somebody. So we're not sending you emails every day. It's just once a month. We reached out to a bunch of members, and we said, hey, we got this woman who needs your help. And they're like, hey, instead of $100, can I give you $200? Because I can't imagine what it would be like if you're 19 and didn't have a hand. I can't do anything else. I live in Florida and this person's in Tennessee, but I'd like to contribute. Like, you would never call Blue Cross Blue Shield and be like, hey, can I pay $200 this month instead of $100, right? Like, you would never do that. So there's a personal connection there that I think is really, really powerful. We have miscarriages all the time. And whenever we ask for a miscarriage, people always will come back and be like, hey, what can we do for this family? Like, I know they're going through stuff. Like, I've been there too. I've felt the pain that they're feeling. Like, what can we do for them? Like, that's totally different than this centralized health insurance model where you send it to the insurance company. The insurance company then decides what they pay and what they don't pay. This is a decentralized model where it's like, no, Ken can decide to pay for me or not decide to pay for me. It's up to him, right? And if you don't want to pay for it, you don't have to pay for it. So it's a decentralized model but it's connecting human beings. And so, our little tagline is like, fund humans, not health insurance.
And the more people, the more powerful.
The more people, the more powerful we become.
Imagine 100,000 people.
Yeah. And so our goal in the next 2 years is to get to 100,000 people.
Yeah, or 1 million people.
Yeah. I mean, I think it's very reasonable.
Yeah. I mean, especially with everybody being if everybody was happy with their insurance, then maybe not. But if everybody's so unhappy and so unhealthy too, right? There's like this whole MAHA movement because we're so unhealthy and we spend so much money. This country spends more money than any other country, but it's the most unhealthy, the most obese, most sick children, everything, right?
Yeah, for sure. So
there's a big need.
A huge need.
Yeah.
I mean, I'd love to have millions of people in this thing. Yeah. My next couple of years, I think we can get to 100,000. Mm-hmm. And then it grows exponentially beyond that, because the more scale we have, the easier it is for us to get you to a really great MRI provider, right? If I only have 100 people in LA, I don't know how many I have, but we have, 300 or 400 in Austin. Mm-hmm. It's hard for me to know that MRI guy will do it for $300. But as you get more and more people, we get all that data internally. So the next person that's going to go and get an MRI, we're going to say, hey, Ken got an MRI here and it's $300. Go try there, right? So we can direct you to, we know it was a good experience. We know that you got good quality and it was a great price. Like, that builds upon itself, and that data is really, really powerful. Of course, I'm not going to tell Ken went, but we're going to say another member went to this place and it was great. I'm going to allow you to then rank them and say, hey, was it a good experience? Was it not a good experience? But it becomes much more valuable to our community as we grow and as we expand. The other thing is, if you have $1 million bill, would you like 100,000 people to be able to help you with that? Or would you like 10,000 people to help you with that? Of course you'd want 100,000. Of course you'd want 1 million people. And so as we grow, I think the people who have the fear, uncertainty, and doubt, that starts to kind of peel away as you grow. And so as we grow, we're getting more and more momentum. It is a hell of a lot harder to get somebody to join CrowdHealth when we had 100 people than it is when you have 10,000, for obvious reasons. So we're picking up speed.
And the doctors don't compete. There's no you suck, I'm going to go there. Because people just are helpless and uneducated. They just go wherever. And especially with MRI places, I saw in LA, all of them are rated bad on Google. Horrible service, horrible how they treat you, everything, and super expensive. So if you then you also make them more competitive. If there's so much information and you get the data, then I won't go there anymore.
Why are hospitals terrible to go to? Why are MRI facility is terrible to go to. Why are they terrible? Because you're not paying them. They don't have to satisfy you.
Exactly.
They have to satisfy, the health insurance plan. So what happens to the system when they actually have to start satisfying you? You're the end customer. So, if you're not paying for the product, you are the product. Yeah. And guess what? In healthcare, you are not paying for it, so you are the product. Like
the experiment.
Yeah, you're the little mouse running around the hamster wheel or whatever, right? Like that's what you are in our current healthcare system. So opt out of that. Opt out of that and be your own, sovereign individual and take care of your own healthcare expenses. And if you have something really big happen, you got a community of thousands of people and growing to help you out with it. I mean, that seems to me like the legit way of doing this.
Absolutely. I really hope that more people find out about this.
Well, this will help.
CrowdHealth ASAP.
Thanks for having me on.
Yeah, tell everybody how they can sign up.
Yeah,
where to go and how easy it is.
Yeah, it's super easy. Join CrowdHealth.com, and the sign up process is like under 5 minutes. You can sign up anytime. It doesn't, you don't have these renew periods or things like that. It's month to month. You can quit anytime you want. We'll put a promo code in there, Candy. Does that work?
Yeah.
Candy, $99 for the first 3 months per month. And so if you join on with Candy, we'll let Ken know. And so join CrowdHealth, and then all of our Twitter handle and Instagram handle and things like that are all join CrowdHealth. So we'd love you to join us there. We're pretty sassy in our social media. We're not your grandma's health insurance plan.
And then it starts at what age?
Yeah, from if you can start whenever, and it goes up to 65. So when you go to Medicare, we don't have a Medicare plan for you right now, but we probably will have something for folks going into Medicare here shortly. So you'll hear about that, and you can start whenever. If you have a child under 6 months old, they can't join until they're 6 months old. If you are pregnant, just know that that's not fundable. If you want to become pregnant, then join us now before you become pregnant. Because in essence, what we can't have is people just like jumping in and having the crowd pay for their pregnancy and then jumping out.
Yeah.
But if you're a member of the community and you get pregnant, it's like, of course. And so number one expense in the community is babies. 45%, I think, of the funds go to babies. And second is active injuries. So it's people reproducing and out having, living life, and things happen. It's mountain bike fake face plants and torn ACLs playing tennis and things that just happen to active people. But for me, it's like, I'm happy to pay for those things. Like that's just going to happen if you're out living life. So those are the number one and two. I think it's 75% or 80% of our funds go to one of those two things.
Better than diabetes and cardiovascular disease.
It's like 10% of illness, and then 10% of wellness.
Awesome. So, and what are the weight limits?
I think it's 260 for men, 220 for women.
That's pretty high, anyways.
It's pretty high, and it's going to come down again shortly. So if you're close to that, you better join now because we're going to lower it. Yeah. So it's still pretty high.
Yeah.
But yeah.
Okay. Awesome.
Yeah.
All right. Thanks, Andy.
Thanks for having me.
Uh-huh.